Hello, everyone. My name is Olivia Duffy. I'm a health educator for Argus Community's CATCH program, Community Action to Combat HIV and Hepatitis C. For what I do as a health educator is I test for HIV and hepatitis C, as well as conduct group and confidential sessions on sexual health, mental health, COVID, and tobacco cessation. So since August, we have been doing a tobacco cessation webinar. We have 2 sessions every Tuesday at 2 p.m. and every Tuesday at 6 p.m. So be sure to check those out. And today, we will be continuing on with the series and talking about secondhand smoke. So let's get started. Next slide, please, Sean. So the overview and purpose is for participants in this webinar to understand what secondhand smoke actually is, how it affects the body and different demographics, and how to prevent its effects. We do hear a lot about secondhand smoke, but people really don't know the actual drastic measures that actually happens when you are exposed to smoke, even if you are the one not actually consuming any type of tobacco product or smoking any type of tobacco product. So it's important to understand the actual definition of how you can be exposed to secondhand smoke. Next slide, please. So what actually is secondhand smoke? So secondhand smoke is the combination of smoke from the burning end of a cigarette and the smoke breathed out by smokers. So that smoke, the secondhand smoke, it contains more than 7,000 chemicals, and hundreds are toxic, and about 70 of those chemicals can cause cancer. Since 1964, when Surgeon General's report, which came out about how smoking affects the body in negative ways, 2.5 million adults who were non-smokers died because they breathed secondhand smoke. It is also can be just the smoke that is exhaled and breathed out, what I talked about before, by the actual person smoking. So that's essentially what it is. Tobacco smoke contains more than 7,000 products. I said that as well. And the mainstream smoke and side stream smoke, which are very notable as well. Mainstream smoke is the smoke exhaled by a smoker, which is the one that causes secondhand smoke, and the side stream smoke, which is smoke from the lighted end of the cigarette, pipe, or cigar, or tobacco burning in a hookah. This type of smoke has higher concentrations of nicotine and cancer-causing agents than actual mainstream smoke, because it comes from the specific product, whereas mainstream smoke is smoke that is coming from the mouth of an individual. So that is differences. However, they do cause negative effects that are both considered secondhand smoke. Next slide, please. So thirdhand smoke, which is a very, very relatively new concept. It denotes the persisting particulate matter that becomes embedded in environments exposed to cigarette smoke even after the smoke has cleared from the air. So essentially, it means that the particles from the smoke still can be attached to furniture or other products that it just latches onto, even if the smoke isn't in the air anymore. And that's kind of what can also cause issues for an individual who's near that product, or constantly sitting on that product, breathing in very too close to the specific area. Some researchers have surveyed indoor environments exposed to secondhand smoke and found multiple compounds lingering on furniture and other surfaces, such as nicotine and even carcinogenic nitrosamines. However, though, even though, like I said before, it's a relatively new concept, there still needs to be a lot more research to understand the whole potential health risk of thirdhand smoke, especially for infants and babies who, place their mouths on a lot of unedible objects, like furniture or, door handles sometimes. So it could lead to oral exposure of THC compounds, but there's obviously still more research to be done with thirdhand smoke. I just wanted to bring it up just so you could get a little better of understanding if it does get brought up sometime soon. Next slide, please. So there is no risk-free level of secondhand smoke exposure. Even the briefest types of exposure can actually be very harmful to the body. It causes numerous health problems in children and infants, includes very frequent and severe asthma attacks, respiratory infections, ear infections, and sudden infant death syndrome, which is SIDS. Smoking during pregnancy can also result in more than 1,000 infant deaths annually. And some of the health conditions caused by secondhand smoking in adults include coronary heart disease, stroke, and lung cancer. Next slide, please. So these are just some key facts about smoking and secondhand smoking. Secondhand smoke causes approximately 7,330 deaths from lung cancer and 33,950 deaths from heart disease each year. So between 1964 and 2014, which I believe was 50 years, I'm trying to do the math in my head, 2.5 million people died from just exposure to secondhand smoke. And according to the 2014 report from the U.S. Surgeon General. So this also concluded that secondhand smoke is also a definitive cause of stroke. So again, there is no risk-free exposure to secondhand smoke. And even in short-term exposure, like I said, can also increase the risk of a heart attack. Secondhand smoke contains hundreds of chemicals known to be toxic and carcinogenic, which I mentioned before. But this also includes chemicals such as formaldehyde, benzene, vinyl chloride, arsenic, ammonia, and hydrogen cyanide. Like I said before, it can cause heart attacks. Any type of, like I mentioned, there is no set time that, if you're exposed to 30 minutes or less, you're fine. Any type of brief exposure can potentially trigger any type of health risk, can trigger a heart attack, which according to the report by the Institute of Medicine. So it really doesn't have to be a brief exposure. You can very much put yourself at risk for even just being near someone at any time. Next slide, please. So secondhand smoking in children, I have briefly mentioned before that there are a lot of health effects, particularly for infants and young children, but it is extremely harmful. Secondhand smoke is responsible for 150,000 and 300,000 lower respiratory tract infections in infants and children under 18 months of age. So that's resulting in between 7,500 and 15,000 hospitalizations each year. And it also causes 430 sudden infant death syndrome deaths in the United States annually. So that's every year. Secondhand smoke exposure can also cause a buildup of fluid in the middle of the ear, resulting in 790,000 doctor office visits per year, as well as more than 202,000 asthma flare-ups among children each year. And then more than 23 million, or about 35% of children in the United States, have been exposed to secondhand smoke. We, especially living in New York City, we are constantly always exposed to a lot of people, especially pre-pandemic. We kind of realized that. And, a lot of people are smoking outside. You're never not near someone that doesn't smell like smoke. So even that brief exposure really puts them in harm's way. And it's particularly with children too, especially with parents who do smoke. There's really no way to kind of get away from that exposure, especially if it's in your own home. Next slide, please. For middle and high school students, this is just a graph. For those who have never used tobacco are exposed to secondhand smoke. So 14.7% are exposed inside a vehicle, 15.5% are exposed at home, and 35.2% are exposed in outdoor and indoor public areas. For the most part, from when I've been around, usually there is no indoor smoking, so everyone is smoking outside. And coming from what we know about close quarters and open spaces, particularly with COVID pandemic, it's harder to, get COVID outside than it is inside. However, though, the risk is still there. So that's the same with smoking, even though inside you're in close corridors. So it's harder. It's harder to really get away from the exposure. Outdoor, you could still be it because you're still around the same smoke. You're breathing in the same air. So yes, you could still be exposed to secondhand smoke outside. Next slide, please. So just more health problems for children. So studies show that older children whose parents smoke get sick more often, their lungs grow less than children who do not breathe secondhand smoke, and they get more bronchitis and pneumonia. Wheezing and coughing are more common in children who breathe secondhand smoke. Secondhand smoke can trigger an asthma attack in a child, which we mentioned before. It can also trigger an asthma attack in adults as well. So children are not exempt from that. And children with asthma who are around secondhand smoke have more severe and frequent asthma attacks. A severe asthma attack can put a child's life in danger. We have mentioned that smoking does cause a lot of respiratory infections, and it doesn't exclude anyone, especially being exposed to secondhand smoke. Because like I said, you're breathing out. If you are someone who smokes, you're breathing out all those chemicals that other people breathe in. So it could definitely trigger a lot of these asthma attacks in children, especially if they are consistently around you. Children whose parents smoke around them get more ear infections. They also have fluid in their ears more often and have more operations to put in ear tubes for drainage. Next slide, please. So this is just a quick breakdown from what I just reviewed to you. So it can cause ear infections. It can cause more frequent and severe asthma attacks, respiratory infections, symptoms, respiratory infections like bronchitis, pneumonia, and then coughing, sneezing, and shortness of breath, and a greater risk for sudden infant death syndrome. Next slide. So there is, I did mention, though, it's harder for exposure. It's harder to limit your exposure, but there's still a lot that can be done to help protect children against secondhand smoke. So you could help protect your child from secondhand smoke by taking these following actions. Do not let anyone to smoke anywhere near or around your home. Like I mentioned before, it's a lot harder for children to kind of, especially young children, if they are at home, to really escape exposure like that. So make sure that no one is smoking inside your home or near it, where children are around. Do not allow anyone to smoke in your car, even with the window down, because like I mentioned before, they are starting to research thirdhand smoke. So if you are smoking in the car, the particles from that smoke can still get onto the seats and whatnot, and doesn't necessarily always get aired out. Number 3, make sure your children's daycare centers and schools are tobacco free. That is very important as well. Your child is learning and growing as an individual, and if they're getting exposed to secondhand smoke, it's going to be a lot harder for their health. If your state still allows smoking in public areas, look for restaurants and other places that do not allow smoking. No smoking sections do not protect you or your family from secondhand smoke, which is true, because if the second no smoking section is close to the smoking section, the air is still getting breathed in. So just make sure you are looking for places that do not allow smoking in that place. Okay, next slide. So as we did go over health effects in children, I'm going to go over health effects in adults. Even if an adult has never smoked, you could still have the risk from secondhand smoke of heart disease. Breathing in secondhand smoke has immediate harmful effects on their heart and the blood vessels. And it is estimated that secondhand smoke caused nearly 34,000 heart disease deaths each year during 2005 and 2009 among adult non-smokers in the United States. It also can cause lung cancer. Secondhand smoke exposure caused more than 7,300 lung cancer deaths each year during 2005-2009 among adults non-smokers in the United States. It also can cause stroke, and a lot of these can really just be reduced. These risks can be reduced with smoke-free laws. So this can help you reduce your risk for heart disease and lung cancer among non-smokers. Like I mentioned before, about the protection for children, that could still be in place for adults. It's not limited to children. Next slide. And another thing, research has shown that pets can be actually affected by secondhand smoke. Dogs and cats are twice as likely to develop nasal cancer if their owner smokes as compared to animals in households without cigarette smoking. Like I mentioned before, they really can't escape exposure if you were smoking in your home. So they are breathing in the harmful chemicals coming from the cigarette smoke. So And a lot of people don't realize that. But yes, dogs and cats can get, are very much affected by secondhand smoke. Next slide, please. So patterns of secondhand smoke. Exposure to secondhand smoke can be measured by testing saliva, urine, or blood to see if it contains consonine. And consonant is created when body breaks down the nicotine found in tobacco smoke. Next slide. So even though I did mention a lot of prevention and the effects of it, secondhand smoke exposure has actually decreased in recent years because of the measures of Consonant, which I talked about before, show that exposure to secondhand smoke has steadily decreased in the United States over time. So during 1988 to 1991, almost 90 of every 100, so about 87.9 non-smokers had measurable levels of Consonant. During 2007 to 2008, about 40 of every 100, so that's 40.1% compared to the 87.9. That was almost 20 years before. Non-smokers had measurable levels of Consonant. And then during 2011, 2012, about 25 of every 100, 25.3 non-smokers had measurable levels of Consonant. So from the big age gap from big year gap from 2008 to 2011, which is only 3 years, it dropped from 40 to 25%. So that is pretty remarkable, but we still have a lot to go. Next slide. So why is there a decrease? That usually is likely due to just the states and the communities that are implementing these laws that you cannot smoke in indoor areas or workplaces and public places. And that includes, bars, restaurants, and casinos, and the growing number of households who are voluntarily having smoke-free home rules. And also, what we've noticed that there is a significant decline in cigarette smoking rates. However, that does not necessarily mean tobacco consumption has declined or any type of smoking products, regardless of tobacco. It's just there has been a cigarette smoking decrease. And the fact that smoking around non-smokers has become less socially acceptable. So these are some of the reasons why it has been decreased, but it is not fully gone. That's what so even though there is a significant decrease, it's still very important because people are still having effects from, or, risking any type of heart disease, stroke, and lung cancer from particularly just exposure from secondhand smoke and years of it. Next slide. And again, like I said, people are still being exposed to secondhand smoke. So during that 2011 and 2012 area, when I talked about the decrease of the levels of Consonant in non-smokers, during that same time, 2011, 2012, about 58 million non-smokers in the United States were exposed to secondhand smoke. So among children who live in homes in which no one smokes indoors, those who live in multi-unit housing, for example, so that's any type of condo or apartment, they have 45% higher Consonant levels. So almost half the amount than children who live in single family homes. So during 2011, 2012, 2 out of every 5 children ages 3 to 11, including 7 out of every 10 Black children in the United States were exposed to secondhand smoke regularly. Secondhand smoke is definitely part of your risk. Just increases higher, especially if you are in an apartment or a condo, you're with other people. It's not just specifically your family. So you are exposing yourself to greater secondhand smoke levels. During 2011, 2012, more than 1 in 3, which 36.8 non-smokers who lived in rental housing were exposed to secondhand smoke. Next slide. So I briefly mentioned that in the last slide that 7 out of every 10 Black children in the United States were exposed to secondhand smoke regularly. Secondhand smoke does have different effects on different races. Consonant levels have declined in all racial and ethnic groups, but the consonant levels continue to be higher among non-Hispanic Black Americans than non-Hispanic white Americans and Mexican Americans. Non-Hispanic white Americans, and Mexican Americans. Nearly half of Black non-smokers, which is 46.8% in the United States, were exposed to secondhand smoke. And about 22 of every 100, so 21.8% of non-Hispanic white smokers were exposed to secondhand smoke. So it's a pretty big difference. Nearly a quarter, so 23.9% of Mexican American non-smokers were exposed to secondhand smoke. So Black Americans are exponentially have higher rates of exposure to secondhand smoke, which I will go into in the next slide. So next slide, please. So like I mentioned before, Black Americans Black Americans, so children or adults, are more likely to be exposed to secondhand smoke than any other racial or ethnic group. So during 2013 to 2014, secondhand smoke exposure was found in 66.1% of African American children aged 3 to 11, 55.3% of African American adolescents aged 12 to 19, and 45.5% of African American adults aged 20 years or older. So these Black American non-smokers have higher levels of the Consonant levels that I mentioned before. So that's an indicator that they have been recently exposed to tobacco smoke. And they have generally higher Consonant levels than any other race or ethnicity. Next slide. Secondhand smoke with Mexican Americans. So during the 2011-2012, nearly 58 million people were exposed to secondhand smoke in the United States, and that includes 6.2 million Mexican American non-smokers. During that same time, so 29.9% of Mexican American children aged 3 to 11 were exposed to secondhand smoke, and 16.9% of Mexican American adolescents aged 12 to 19 years, and 23.8% of Mexican Americans aged 20 years or older were exposed to secondhand smoke. Next slide. So you could definitely see that there has been a bit difference in racial groups. It is also a bigger difference with individuals with lower incomes. So you can definitely see kind of the correlation. It's significantly higher, again, with people with lower income. So during 2011 to 2012, more than 2 out of every 5, so 43.2% of non-smokers who live below the poverty line were exposed to secondhand smoke. And like I said, it is extremely environmental. Black Americans are consistently living in more, what's the term? In kind of cities or towns where there are a lot of apartments, everyone's kind of close packed together, more so cities than regular suburban areas or single family homes. So therefore, that has a big correlation to their exposure to secondhand smoke, considering the fact that they are constantly, there's really no room to get out or, not risk exposure. But again, secondhand smoke exposure is higher among people living below the poverty line and those with less education. So the lower SES populations will suffer from harmful health consequences of exposure to secondhand smoke. One of the most likely the jobs that are more likely to be exposed to secondhand smoke at work are blue collar workers compared to white collar workers. So this is particularly service workers, bartenders and wait staff. They report the lowest rates of workplace smoke-free policies than any other occupation category. Next slide. So I'm going to go into that as well with the workplace, secondhand smoke in the workplace. Secondhand smoke costs our economy 5.6 billion, not million, 5.6 billion per year due to lost productivity. The health risks, the health of these non-smokers who are exposed to the secondhand smoke is at an increased risk, like I mentioned before. So levels of secondhand smoke in restaurants and bars were found to be 2 to 5 times higher than residences with smokers, and 2 to 6 times higher than in office workplaces. So being in, like I said before, if you are working in an environment where smoking is prohibited, it's going to have a bit of a reduction in any type of risk of secondhand smoke. Whereas if you're being employed in a workplace where those regulations are not issued, you're putting yourself more at risk, and everyone around you is being put at risk of the secondhand smoke exposure. So being employed in a workplace, again, like I said, where smoking is prohibited is associated with a reduction in the number of cigarettes smoked per day and an increase in the success rate of smokers who are attempting to quit. So casinos are very well known for open areas of public smoking. So, they're exposed, these casino workers, to hazardous levels of toxic secondhand smoke at work, including tobacco-specific carcinogens that increased in their bodies as their work shifts progressed, according to a report from the National Institute for Occupational Safety and Health. So it is a lot harder for just the workers in general, because they're not in that area for like maybe an hour or so. They're in there for their whole shift. So they have been exposed for a good portion of the day and continuously get exposed. Next slide, please. What slide? Yes. Okay. Is that the right slide? No, the next slide. Because I think I went over that. Yeah. Smoking in vehicles. So smoking inside vehicles can pose as an even greater danger to non-smokers. I did mention that before when I brought up how you could protect children and adults from secondhand smoke exposure is to not smoke in your car. So smoking inside vehicles can pose an even greater danger to non-smokers because, like I said, it's a very tight and compact area. So those concentrations of secondhand smoke are often higher in vehicles than inside homes and bars. So more than 8% of non-smokers, so about 8.2, are exposed to secondhand smoke in a vehicle within the previous 7 days. Non-smokers exposed to secondhand smoke in cars are at increased risk of cancer. And from 2013 to 2014, 79.5% of adults have a smoke-free vehicle rule, which should be implemented and helped reduce the risk of exposure. Just think about it. If you're on the train or in a car, if someone was smoking, everyone else is breathing in that contaminated air, and there's really nowhere to go. So that's why it has a bigger increase of putting yourself at risk. Next slide. Okay. So I did mention before that secondhand smoking does cause cancer. But it is very known to be very cancerous. Like I said, there's 7,000 chemicals that come in from the air of secondhand smoke, and 70 of those 7,000 chemicals can cause cancer. And it does cause, even if you never lit a cigarette or even breathed in that smoke from the product, there is a lot of evidence that secondhand smoke can cause a variety of cancers. It can cause cancer in the larynx, which is your voice box, cancer in the nasopharynx, which is the part of the throat behind the nose, nasal sinuses, Brias. An exposure of babies and mothers to secondhand smoke is possibly linked to specific childhood cancers, lymphoma, leukemia, and brain tumors. Next slide, please. And as I mentioned before, it's not just cancer that has an immediate effect from secondhand smoke. It is also cardiovascular system and your heart itself. Secondhand smoke has immediate adverse effects on the cardiovascular system and can cause coronary heart disease and stroke. So secondhand smoke in general causes nearly 34,000 premature deaths from heart disease each year in the United States among non-smokers. And that's just non-smokers alone. As I mentioned before, I have to emphasize non-smokers because we do know these risks do happen if you were someone who does smoke. So that's why I consistently am emphasizing non-smokers. So even if you aren't smoking, you could still have a premature death from heart disease just from breathing in that smoke. Non-smokers who are exposed to secondhand smoke at home or at work increase their risk of developing heart disease by 25 to 30%. Secondhand smoke increases the risk for stroke by 20 to 30%, and secondhand smoke exposure causes more than 8,000 deaths from stroke annually. Next slide. And just a continuation from the previous slide, breathing in the secondhand smoke can just immediately have adverse effects on your blood and your blood vessels, and that's how it increases the risk of a heart attack. breathing in, so the secondhand smoke does interfere with your normal function of the heart, their blood, and your vascular systems in ways that that's how it increases the risk of a heart attack. So even just brief exposure, like I mentioned before, it doesn't have to be, a year's worth of exposure. It could definitely be just a brief exposure to that secondhand smoke that could really damage the lining of your blood vessels and could cause your blood platelets to become stickier. These changes can cause a deadly heart attack. And people who already have any type of heart disease, they're especially high at risk for suffering the adverse effects from just breathing in the smoke. So they should really take precautions to try and avoid these brief exposures. Definitely have a little bit more of a smoking free regulations. Next slide. In particular, I wanted to talk about lung cancer. And like I mentioned before, secondhand smoke causes cancer and it causes lung cancer. In non-smokers who are exposed to secondhand smoke at home or at work increase their risk of developing lung cancer by 20 to 30%. Secondhand smoke causes more than 7,300 lung cancer deaths among U.S. non-smokers each year. And non-smokers who are exposed to secondhand smoke are inhaling many of the same cancer-causing substances and poisons as smokers. Even brief secondhand smoke exposure can damage the cells in ways that set the cancer process in motion. And as with active smoking, the longer the duration and the higher the level of exposure to secondhand smoke, the greater the risk of developing lung cancer. So even though I did say like even the briefest of risk, but again, it does get a lot worse if you were in there for a specific amount of time. So that is how with every a second that you do breathe in the secondhand smoke, it will damage your cells, and then this cancer process can be in motion. So anytime you do that, it just continues on and on within your body. Next slide. So data shows that patients with non-small cell lung cancer, so the most common type of lung cancer, who are exposed to secondhand smoke have actually the worst of outcomes. So that includes just overall survival, so reduced overall survival, reduced progression-free survival, so the length of time during and after treatment when the cancer does not grow or spread. And just simply put, lung cancer patients exposed to secondhand smoke are more likely to die than patients not exposed to it. So exposure to secondhand smoke makes it harder for lung cancer patients who smoke to quit smoking. So smoking during lung cancer treatments make the treatments less effective. So if you are someone who is smoking or exposing yourself to secondhand smoke while you were a cancer patient, not only does your treatment that you're on become less effective, you make yourself harder to actually improve your health. Next slide. I mentioned sudden infant death syndrome before, but it is the sudden and unexplained and unexpected death of an infant in the first year of life. And it is the leading cause of death in otherwise healthy infants. And like I mentioned before, this is increased by secondhand smoking. Smoking by women during pregnancy also increases this risk. Infants who are exposed at secondhand after birth, again, that's a greater risk for SIDS. And chemicals in secondhand smoke appear to affect the brain in ways that interfere with its regulation of infants' breathing. Infants who die from sudden infant death syndrome have higher concentrations of nicotine in their lungs and higher levels of consonant. So like I mentioned before, the marker that someone has been exposed to secondhand smoke, the consonant, than infants who die from other causes. So not very much talked about, but people don't really see the correlation on the outside. So it's very important to educate yourself on the effects that secondhand smoking still has on the body and children as well. Next slide. So just brief. So you can help protect your child from sudden infant death syndrome by taking the following 3 actions. Do not smoke during pregnancy. Do not smoke or allow smoking in your home and around your baby. And place your baby on his or her back for all sleep times and naps. And so any naps and at night. Next slide. So as I mentioned before, how you could protect your child, but you can protect yourself and others around you. You can protect yourself by quitting smoking if you are not already a non-smoker, not allowing anyone to smoke anywhere or near your home. So like I mentioned before, don't let anyone smoke in your home. Don't let anyone smoke in your car, even with the windows down. And making sure your schools that your children go to or that you go to are tobacco free. Try to seek out restaurants and other places that do not allow smoking. Teaching your children to stay away from secondhand smoke and teaching others around you, and being a good role model by not smoking or using any type of tobacco products. I reiterated a couple times, but I'm just making sure. Next slide. And so SmokeFree Homes, I did mention it a lot throughout this webinar, but to just protect yourself from secondhand smoke exposure, studies indicate that smoke-free homes and workplaces encourage smokers to quit and reduce the number of cigarettes they consume per day. The percentage of homes that are voluntarily smoke-free have been rising. So that's between 2010 and 2011. 83% of adults reported they live in a home where smoking indoors was not allowed, and 93% increase from 1992 and 1993, where 43% of people reported living in a smoke-free home. So big difference from 83 to 43. That's the almost half of it, almost doubled. Smoke-free homes are much more common among people with higher levels of education throughout all racial and ethnic groups and in states with lower rates of adult smokers. The United States Department of Housing and Urban Development have mandated that all public housing agencies adopt a smoke-free policy by 2018. So by now, this should be almost 3 years, that all public housing should have mandated the smoke-free policy. So this would have helped prohibit the use of combustible tobacco products in all indoor areas, living units, and office units, and within 25 feet of those areas. It could be implemented, but some people don't have to follow it, or not, they won't follow it. So that's still something to be said, but because of this, because of these implemented policies, this has definitely decreased the risk of secondhand exposure. Next slide. And this is just a graph. So 28 United States and territories have enacted comprehensive smoke-free laws. So orange is the enacted smoke-free laws, and gray has not. So more than 42% of the population is not protected by comprehensive smoke-free laws. So that is a little less than half, but that's still really not enough. And as you could see, it's mostly the South, around Pennsylvania, Connecticut, New Hampshire, and some of the Midwest. Next slide. So as I showed before, although 28 United States and territories have enacted comprehensive smoke-free laws, so there's still a big disparity in the gaps in coverage, particularly like I mentioned before with the southern states, and in places where state laws preempt local smoking restrictions. And like I said, more than 42% of the population is not protected by any type of comprehensive smoke-free law. Lower income communities are less likely to be protected by smoke-free laws. Many multi-unit housing communities have begun to implement smoke-free policies to protect residents from the risk of secondhand smoke, which can help infiltrate homes from neighboring units. And like I mentioned before, it has been enacted and required that all public housing agencies would enact the smoke-free policy. But even like I mentioned before, close corridors and gaps, especially with public housing, your risk of exposure is fairly significant. So it is important to have smoke-free policies. So if you are living in public housing or do know someone in public housing, make sure that these are very much implemented. So as I mentioned, next slide, please. As I mentioned before, one of the biggest reductions that you could do as an individual to stop the levels of secondhand smoking is, if you are a smoker, you could stop yourself. I know a lot of people necessarily don't believe that quitting smoking could actually be beneficial to them, because they just believe that what's done is done to their body, which is not necessarily true. You could still very much live a healthy and happy life after you quit smoking. Your body continuously rejuvenates itself, as well as others. So if you stop smoking, others around you will also expose themselves to the risk. But there's still a big difference when you do stop smoking. So just for your heart in general, if you stop smoking, you'll notice a difference after 20 minutes. Your heart rate and blood pressure will drop. 12 hours, the carbon monoxide level in your blood drops to normal. 1 to 9 months, coughing and shortness of breath decrease. The cilia, which is the tiny hair-like structures that help move mucus out of the lungs, they then start to regain normal function in your lungs, increasing the ability to handle mucus, clean the lungs, and reduce the risk of infection. 1 year, the excess risk of coronary heart disease is half that of a continuing smoker's. 5 years, risk of cancer, the mouth, throat, esophagus, and bladder are cut in half. Cervical cancer risk falls to that of a non-smoker. Stroke risk can fall to that of a non-smoker after 2 to 5 years. 10 years, your risk of dying from lung cancer is half that of someone still smoking. And risk of cancer of the larynx, which is your voice box, and pancreas decrease. In 15 years, your risk of coronary heart disease is equal to that of a non-smoker's. So, like I mentioned before, it's never too late to quit, and it's never too late to help implement smoke-free policies in your home or your family as well. So, like I said, your body continuously rejuvenates. So if you do stop, if you do quit smoking, if no one in your house smokes, it could definitely help. It will still be very beneficial to that of a non-smokers if no one smokes in your house. So make sure, it's never too late to quit. It's never too late to implement everything because, like I said, our bodies continuously rejuvenate, and the damage is never just done. Next slide. There are many ways to quit smoking. These are a few of some of the ways. There's nicotine replacement therapy. You could just help avoid your triggers, change your schedule, delay every time you do smoke, try and get physical, put some exercise, implement an exercise routine, practice relaxation techniques, and help call for reinforcements. Next slide. If you do need help quitting, especially in the New York City area, we have listed a few places. ACN Tobacco Cessation Services, so New York Presbyterian Columbia, Montefiore Health System Tobacco Cessation Program, New York City Health and Hospitals, Gotham Health, Cumberland Behavioral Health Pavilion Smoking Cessation Program. Ooh, that was a long one, but they're very helpful. New York City Health and Hospitals Elmhurst Smoking Cessation Program, and Richmond University Medical Center Tobacco Cessation Program. And then below we have linked NewYorkCity.gov to help you with a cessation guide of a place that might be near to you if you are looking to help quit. Next slide. These are also some other websites that we have found in our resources that could also help you. SmokeFree.org, which is a texting program to help quit. And just how-tos as well. So very informative. Next slide, please. So just want to thank you all for joining us today. Like I mentioned in the way beginning of this, my name is Olivia Duffy. I'm a health educator for HIV and hepatitis C, and as well as doing group sessions, tobacco cessation, mental health, sexual health, all kinds of stuff. But these are some of the resources that we have for you. So in New York City, how can we help? So this lovely picture is my coworker, Christopher Olin. He's the behavioral health coordinator. So what he can provide to you is HIV and hepatitis C pre and post test counseling, the GPRA, the Government Performance and Results Act. He can connect clients to HIV, hepatitis C medical services. He can connect clients to substance use services, which also include tobacco cessation, connects you to mental health services, connects you to local food pantries, and can assist uninsured individuals to get access to medical insurance. So he has a lot to offer, and this is his information. If you ever need it, he's the person to reach out to. Next slide. And again, thank you so much for joining us today. If you have any questions, you can please email us at arguscatch@gmail.com. Our number is 929-322-4106. You can also find us on the arguscommunity.org, and you could follow us on social media. We have a YouTube, a Facebook, Instagram, Twitter, you name it. And this is also our link tree where you could find all of our other tobacco, any type of our webinars as well. Like I said before, we do a tobacco cessation webinar, one at Tuesdays at 2 and one at Tuesdays at 6. But we also do a sexual health webinar every Wednesday at 2 p.m. as well. So be sure to check that out. Thank you so much. And hopefully we'll catch you on the next one. Bye.